Welcome back. November is Lung Cancer Awareness Month. It was someone in Carolina's family who drew our attention to this important issue. This photograph comes from Becky Price, who wrote to tell me that her husband Gary was diagnosed with stage 4 non-small cell lung cancer last fall. He's just 39 years old. Now, he says he smoked in his teens, but he hasn't picked up a smoke in 17 years. She wants to encourage people to support more research for lung cancer, and she wrote saying, "I'm just a wife, a caregiver, and a mom fighting for my husband, fighting for my kids." So we're going to pull in Dr. Cedrek McFadden today, our expert, to dig into the risks about lung cancer, what we all need to know about this form of cancer. And, you know, there are things that happen that we can't control and things that we can control when it comes to the risk for this, right?
Yeah, and I think the first question that people ask when they're diagnosed is, how did I get it? What did I do to get it? And risk factors don't necessarily mean that you will get the disease.
Right.
And neither does everyone who get the disease have a risk factor for it.
Right.
But they can increase the chance that you may be predisposed to it.
So what are the things we need to be watching out for in terms of avoidance to keep ourselves as free of lung cancer as is possible?
Yeah, the number one risk for lung cancer is tobacco.
Okay.
That involves smoking. And that could also involve secondhand smoke.
Okay.
And so we try to, number one, try to tell folks to avoid smoking at all costs. And to number two, try to avoid being around anyone who is smoking. As you can imagine, if you're smoking, that air can linger there for over several hours.
Yeah, we've been around it, and a lot of people don't like to be around it. What about when it comes to the other risk factors that we can try to stay away from? What are those?
So the other potentials that you have control over are exposure to things in the environment, radon being one of the leading causes of lung cancer, especially in those that don't smoke. That radon is a naturally occurring radioactive substance. It's a gas. You can't smell it.
Yep.
You
It can
can't
be in your
taste it.
home.
You can't see it. It can be in your home, especially in well or poorly ventilated basements. It can be present in the soil. And so you should certainly be paying attention to perhaps even getting home detection sets or either having a professional come out and check your home for radon.
And some of the other factors you mentioned to me in preparing for this previous radiation, what does that mean?
Yeah, so if you've had radiation to the chest for other cancers, such as breast cancer or certain leukemias or lymphomas, those things can also be a risk factor that you may not have full control over, but certainly those that you should be aware of to bring up to your doctor in your treatment plans.
And family history, does it matter?
Family history always plays a role. However, it's not 100%. Just because your parent may or may not have had it doesn't mean that you will or won't get it as well.
All right, so if we are concerned about this issue in our own lives, where do we pay attention in terms of symptoms? What things should we be watching out for?
So the big ones are cough. If you have a chronic or severe cough that's not getting better, perhaps you're producing blood when you cough, that is a concern that you should definitely bring up to your doctor. Shortness of breath, wheezing. If you're having chest pain when you inhale and take a really deep breath in, that could be also a symptom that you need to have followed up with your doctor.
Any other symptoms that?
So a lot of the other symptoms that we see, such as weight loss or fatigue, those are symptoms that are occurring when the cancer is perhaps a little bit more advanced.
Okay.
And those are perhaps symptoms such as hoarseness that you need to also bring up to your doctor as well.
And we heard this wife and mom saying, hey, we need more research in the lung cancer department. Lung cancer impacts a lot of people.
It really does. It's the number one leading cause of cancer deaths. Lung cancer kills more folks than colon cancer, breast cancer, and prostate cancer combined.
Wow.
And so that's a lot of folks that are affected by lung cancer.
Well, we lost my father-in-law to lung cancer, and it's a tough situation for any family that's coping with it. But again, it gives us a little bit of encouragement that we can spread the word, raise the awareness, and try to help other families to not only avoid anything we can control about this, but also to be aware of the symptoms. Early diagnosis, does it make a difference?
Absolutely. So if you are a smoker or if you have been a smoker in the past 15 years, you should talk to your doctor about whether or not you're a candidate for screening tests, such as a CT scan that may find these cancers, because like all cancers, if we can find it early, we can actually help treat it a little bit better.
Well, Doctor, we appreciate you being
here. Thank you
here.
for having me.
Thank you. And thanks to Carolina's family for keeping us in the know about this important issue. We'll be right back.